Hey there, everyone. Welcome. I'm Errol Barnett, national correspondent with CBS News, joined by an esteemed panel today of really intelligent and interesting folks from around the world who will... Oh, are we still up? Can you guys still see me? My screen's doing some funny things.
I can still see.
Yes, we see you.
Okay, great. So I've got this panel from around the world as the coronavirus pandemic worsens. Here in the US, we have 55,000 people who have died. That number has doubled in the past 2 weeks, and people of color have been the most impacted. And so we wanted to answer people's questions and get a diverse group of folks together to look at how this is impacting people of color around the world and how we can all take care of ourselves. We've got Amara La Negra joining us from Miami, a singer and entrepreneur who's doing a lot of interesting things as far as raising funds, keeping people's spirits high. We've got Dr. Robert Drummond, who is down here. He is the medical director at an urgent care clinic in Los Angeles. Next to him, you see Isha Sesay, a friend of mine from back in our CNN days. The journalist and anchor and author has been holding daily Instagram and I believe Facebook live programs discussing specifically how the pandemic is impacting Africa. And you see Shahan Ramkissoon joining us from South Africa, a news anchor there who's been covering the pandemic locally. And just in time, Rachel Ritefeld, who's having some connection issues, is joining us. She is an entrepreneur in the most ideal location out of all of us. Rachel, just tell us where you are quickly, because you have the best background and it happens to be real.
Background doesn't come with great internet connection, I'm sorry. But I'm in St. Kitts. I'm currently on Turtle Beach. I wanted to share a little bit of positivity with you guys and a little bit of hope and brightness, hoping to cheer you all up today.
Beautiful. Well, you're making us jealous. I don't know if it's like making me feel bright, but I'm a little bit jealous. Let's begin at the beginning. I want to show you all this video. It was recorded recently, apparently in Chicago, and it speaks to the challenges in dealing with this pandemic around the world. Take a look at what you see. And Dr. Drummond, tell me how dangerous this is. Can you see that?
Yes, this is the exact opposite of what we want to see.
So what do you think as a doctor when you see that?
I see a very happy COVID-19 virus that is likely jumping from person to person.
And just repeat that one more time for me.
I said, I'm very happy COVID-19 virus.
You think that's a positive environment for the COVID-19 virus to spread?
Yeah, the virus.
And so what do you say to people who are feeling cooped up? They want to go out, they want to socialize, and they're seeing some states restrict social distancing guidelines.
You know, we have the social distancing guidelines in place for a reason, and it's hard for people to understand why we have them in. And I know that it's frustrating being at home and being away from everyone, but what we just saw there is what will continue to contribute to this pandemic lasting long.
And even at your own clinic, recently you mentioned that there was a scare recently with a doctor who was possibly positive for the coronavirus. What's happened on that front, and what's that?
We have someone that, well, we're getting exposed all the time because we're testing daily, and we're testing patients who are symptomatic and direct verging to the away from our normal patients that we're taking care of to do laceration repair. And so for this individual healthcare worker, we're screening every person who comes in for fevers, and this individual tested and had a fever. And so that just started. Got to get them tested, get them home. And so they're now, even after testing negative, we still want to be cautious of them to the the site.
Wow. And I know we have a little bit of an echo issue. Everyone can try and mute when you're not speaking. And I don't know, Dr. Drummond, if you have headphones with you, that might help as well, if possible. I know you're at work right now. Amara, let me ask you a question about what you've been doing recently, because, you know, as an entertainer, as someone who's always up and vibrant and trying to bring joy, you can't avoid the pandemic. Tell me about some of the things you've been doing.
Well, on my behalf, obviously, I've done my best to stay as active as possible while being home. I was talking to you earlier about how I have become a fan of, you know, actually taking care of my garden. And I think that if it wasn't because of the pandemic and being quarantined, I probably would have never even bothered to pay attention. But now I'm growing my own vegetables, my own herbs. I'm growing fruits in my backyard. Those are some of the things that I'm doing to stay active. You know, obviously, I do my best to tell all my fans and followers to stay home, to work out and dance and just do productive things. But amongst all those things, I also started doing the Untitled Challenge, which is my new single. And I actually gave away $500 thanks to Triller as well. I gave $500 to whoever did the best Untitled Challenge. It was my way of motivating people to stay active and stay with their families while they're in quarantine. I also have been giving out of my own money and also raising money to help the people in the Dominican Republic. As we know, you know, all third world countries are truly going through it as well in this moment. The Dominican Republic is one of those countries that no matter how much you tell people to stay home, they always figure out ways to go outside. And recently, I believe yesterday, Puerto Plata, which is an area in the Dominican Republic, thousands of people came outside to the beaches to pray for the pandemic to go away. But even though they had the best intentions, I think that they only but made it worse at this moment.
So people still, as we saw, they want to socialize, they want to be out, but that's the worst thing, as Dr. Drummond says, that's what the virus wants. That's how it replicates.
At the same time, I think we have to be realistic that there's a lot of, thankfully, we are in a different financial situation, and maybe we can, you know, prolong our stay at home. But a lot of these people, like for example, in my country, a lot of these people live the day-to-day little bit of money that they pick here and there. It's hard for them to stay not even a whole week at home without getting anything else to eat out in the streets. I mean, it's very difficult. So you almost have to understand it's not so much of an entertainment thing as a necessity thing. And I don't know. I feel like this is only but getting worse at this point.
Yeah, and Isha, I'll get to your conversations in a quick second, but that point about understanding your privilege, I want to throw over to Shahan, because you recently on your news program made a point to tell people to check their privilege. What was that about?
Yeah, so of course in South Africa, when they first announced that the lockdown was going to come into effect, we had lots of people racing out to stock up on food supplies, but it was before people actually got paid. Once the lockdown came into effect, we then had poor people who eventually got their salaries going out and queuing, but we had people frowning upon this. And for me, it was like, you know, you need to check your reality, check your wallet, check your privilege, check your circumstances over the next person's, because you cannot judge other people who are standing in a line to do exactly what you did 2 weeks ago because they didn't have money. And that's the reality in South Africa. I mean, white people still earn 4 times more than Black South Africans. And that's why people had to wait until the last day of the month to go and queue in lines. And then they were being slammed by other South Africans. So I thought it was important to actually get people to just take a step back, watch what's happening. Remember that you were in that same long line 2 weeks ago. So this is not a time for you to judge. This is actually a time for you to be understanding and try to help out if you can. Because, I mean, South Africa, of course, is one of the most unequal societies in the world. And we're seeing that at play right now, Errol, because our government has admitted that millions of people are going hungry because they've lost their jobs during this lockdown period and because they simply can't afford to go out on the streets and beg for food.
That's a dire situation. Isha, what have you been learning from your conversations with people on the continent? I think the UN World Food Programme today warned, or recently warned, that they are fearful that people who were on the brink before are even more so now and be pushed over by this pandemic.
Yeah, I mean, it really, to piggyback on what your last guest said, I mean, there's so many people on the continent that need to be going out every day to make ends meet. They're largely in the informal sector. And essentially, you know, we're not in a system with social safety nets by and large. There are no benefits to support them in this moment. And so it's a day-to-day existence. They're unable to go out to trade, in many cases to do, you know, smaller jobs, if you will, that would give them money. But also there's an added problem that with the lockdowns that we're seeing, with borders being closed, with people unable to go into their farms or their fields to harvest, you know, crops that they planted, the food supply chains effectively being impacted. And so, you know, it's a double whammy. It's the case where you may have the money, but then prices are going up because there's not enough food making it to market. Or you may not have the money and can't go out, and you are just in this bind. So I think the question of hunger is a very real one. I mean, if you're talking about East Africa, we're also talking about locusts. You know, a second wave of locusts that has descended like a plague in that part of the world. So that also is decimating crops. It's a multitude of problems. But yes, hunger and food insecurity is a major concern.
There are small things that we can do individually. And Rachel, I want you to speak about that. You run a business. You're in St. Kitts with that gorgeous background we're all trying not to be jealous about. But talk to us about how you converted your business in a very short amount of time to focus on what people need.
Yes, I mean, we've also been faced with similar realities as to what Shahan and Isha have just been talking about. In our bid to try and figure out how can we positively impact. I mean, previously, literally 1 year ago today, we started up a spirits company. So we have always worked very closely with local farmers here. So all our spirits are infused with hibiscus. So of course, when the cruise ship stops and the airplanes were not allowed to come in anymore, you know, we had no more tourists, all the hotels closed. That was our business as a spirits producer pretty much gone overnight, which was devastating. We had to lay off a lot of people, and within a matter of days, we saw what was happening in the world. We realized what the needs were now. It's no longer to have a cocktail on the beach with your friends, but there was a big need for producing hand sanitizer. And we have the expertise and we have the facilities to do that, which is what we have done. So because of that, we were able to bring back a lot of people that we had to let go to come and help us with bottling and labeling, creating some jobs, and we are seen as an essential service. And also, it makes me most proud that we are able to still include all our local farmers here between the island of St. Kitts and Nevis, which is right behind us, to provide us with the aloe vera. We've bought hundreds of pounds of aloe vera. We are a small island. I think we have a population of just over 50,000. So we are helping locally and also regionally. We have also been doing some distribution. So it's not without challenges, but it's encouraging for the people to see that we are trying and we're not giving up, especially to show out our children. You know, I loved hearing what Amara said about growing in her garden. That's what I've been doing with my daughter. On my little balcony in pots, I have tomatoes, I have basil, and we cook together. And of course, we're not naive. We're aware of what's happening in the world, but we're also trying to stay focused and keep our minds focused towards the future and doing what we can do in any way, shape, or form to help each other.
Amen.
Yeah, I think that's wonderful. That's a beautiful sentiment because, and we've spoken about this, Dr. Drummond has been holding regular panel discussions with doctors around the country to answer people's questions. But mentally, it's not just difficult for those of us worried about contracting the virus. It's difficult for doctors as well, specifically people of color. And because we're streaming this live, we're getting questions from Facebook and elsewhere. One question, Dr. Drummond, I'd like you to address is, you know, this concern some people have that by dividing the death rates and the infection rates by race is in some way racist or in some way a loaded thing to do. As a doctor, what's your view on that?
Yes. So, you know, I don't feel that that's racist. I think it's facts, right? And I think that it makes some people uncomfortable to see those facts. I think it makes individuals uncomfortable because it brings up the health disparities that we know have existed for a long time in populations of people of color. And so, it's really important, because if you see a certain group being affected more, then that may mean you need to adjust how you're approaching that group, both in terms of testing and what the expectations will be in some of those populations. So I think it's unfortunate that people, feel that it's racist. It's not racist, but it's bringing something to light. And it's something that even after this pandemic is over, we have to continue to make sure we address and have a conversation about.
Now, switching over to something a bit more hopeful, Rachel had a really good sentiment about using natural resources and everyone helping each other. How have you been staying sane? I would imagine that if a doctor has hacks in how to stay positive, you'd be the guy. How have you kind of...
So for me, I've really focused on, a couple of things. I focused on why I got into medicine in the first place and understanding the calling, but then also I go back home and you hear me talk about decontaminate and decompress. And I have to do that when I get home. The decompression also deals with enjoying time with family, enjoying time with my dog, who was a huge amount of stress relief, and really just kind of appreciating the things that I have. And so I have to try to leave work at work and come home and really focus on family. And I saw someone mention about the garden. We just built my wife a garden in the backyard.
Awesome.
maybe about, I think she's got about maybe 20 square feet or something like that. And we just planted a bunch of things. I love peppers. I love hot peppers, Scotch bonnets, habaneros.
There you go.
So we've got all of that planted. And that's just bonding time that me and her have had, but then also her and my daughter have had as well. So those are kind of things I really try to focus on when I go home.
I think that's wonderful. That's wonderful. I want to talk about some solutions quickly, because I know I want to respect everybody's time. The World Health Organization gave a status update earlier this morning, and they were asked specifically about how South Africa is doing, how it's handling the pandemic so far. And the leadership at the World Health Organization said that the country used the initial lockdown very well. It had 39 mobile labs. It's training 30,000 people to contact trace, which here in the US is something we've even yet to start doing. They're entering the influenza cycle, of course, in the Southern Hemisphere, heading into colder months, which even in South America too is a concern, because you'll have both the battle against the pandemic and the coronavirus. And basically they're saying South Africa is showing the way for the rest of the continent. I wonder if, Shahan, you can talk about what you're seeing that's working and that perhaps other people can learn from South Africa.
Well, I mean, the South African government was super fast in actually responding when we had our first confirmed case. I think it was after 4 cases, they decided to shut down our borders, and then, of course, went on this massive campaign to try to get a hold of every single person who came in contact with another person if they did test positive for COVID-19. Now, let's be honest, Errol, it's a tough task in South Africa, given how big the country is. I think you've been here and you worked here for a while.
Yeah.
And I mean, the South African government went out of their way to actually trace everyone who came in contact with a group of 10 tourists who traveled to Italy back to South Africa. They basically were the first people to have the confirmed COVID-19 in South Africa. And they mapped it out to a point where if they were on a row in a plane, they got a hold of everyone around them. And that's what basically boils down to, being meticulous when it comes to tracing people who have come in contact with those who are confirmed to have the virus. And I tell you what, I mean, our healthcare system is not something to boast about. I mean, we've been trying to fix it for decades now, and we haven't been able to. But given what's happened around the world, our government basically said we are pushing all resources to the healthcare sector. We're setting up buildings to deal with people who are confirmed to have the cases. I said treatment wards are on top form, like a class that we've never seen before. And it's basically our government saying, this is about our survival. That's why we're putting so much effort into it.
Aisha, what about the folks that you've been speaking to? What are some of the things that are giving people hope as far as solutions and things that are working? Because we're not, in fact, the WHO even said, nobody is out of the woods just yet. And some of the questions we're getting in from people are, what if any, are the light at the end of the tunnel scenarios that you're seeing?
Listen, I mean, the show I do every day on Facebook Live, Go Home with Isha Sesay, which is focused on this pandemic in Africa. And of course, when it comes to the sweep of the scourge in Africa, coronavirus made it there later than other places. When it comes to Africa, really, the pickup is just happening now. Last week, they started rolling out 1 million tests, and to get 15 million tests in about 3 months. That's what Africa CDC is saying, to get a full picture of what's happening on the continent. So I think, you know, in terms of people seeing light at the end of the tunnel, I think when it comes to the continent, I mean, I don't know what Shane thinks, because he's in South Africa and they have done such a robust job, even though there's more to be done. I think more broadly speaking across the continent, there's a sense that we're kind of really just getting going.
Right.
So we're not quite there yet to start looking for lights. But I think, you know, when you speak in general, we know that the vaccine is a long way off. The experts have made that very clear, that even best case scenario, you get it quickly in terms of you get the breakthrough, you still have to manufacture and distribute. So we're still months away. So I think really in terms of hope, it's the therapeutics. It's, you know, what medical treatments can we come up with that will alleviate symptoms and save people from death. I think that's the bright spot here, because we know that we've seen an unprecedented amount of R&D, research and development and solidarity in the medical and scientific community, people trying to find the breakthrough. And I think that's the light. That's what I'm holding on to.
And Dr. Drummond, can you speak to, because one of the things that shocked me recently is that we're actually adding now to the list of symptoms that coronavirus patients have. It's not just loss of appetite or loss of taste and smell and fever and cough, but also chills, repeated shaking, muscle pain, headaches, sore throat. And we've spoken previously where you're saying some people are now refusing to even go to the hospital for the ailments they do have. So is it getting worse as far as, you know, the numbers that we're seeing on who has it and who's recovered and who's died from it are likely higher than what we've seen?
Yes, I think that all of the data shows us that the number of people infected are much higher than we know, at least here in America, because we're still not testing the way we should. We're not doing trace testing. B, what we're seeing is that it's very likely that the virus was here earlier than anticipated or earlier than we first believed. There's talks that maybe it was here as late as or as early as late December, early January. Okay, and then also, as you mentioned, yes, we've expanded what we think are what you say COVID symptoms, because we've got studies that are showing that, you know, some individuals, up to 50% of individuals, had GI symptoms, nausea, vomiting, diarrhea, prior to fever and cough, right? So it's almost, we're at the point where we're saying any symptom, right? I mean, that's really what people are, that's where we are. But we're doing that because this virus is not following any of the rules that it should follow. It did not read the rule book on how to act as a virus. Between how many people are asymptomatic, how long the incubation period is, the fact that some individuals have very little, very mild disease, some have moderate, some are dying. The rule books are just out of the window when it comes to this virus. And it's what actually is making this so difficult. When you compare this to the first SARS virus or to MERS, right? The difference is they had a pretty much 100% expression, which means if you got it, within a couple of days you knew and you were sick as a dog. And then also a lot of people died, up to 30% mortality rate, which means it hit you fast and people died. You could identify it, section them off, and then they went away. This virus is not going to behave that way. It hasn't behaved that way. And that's why we're assuming we're going to have a possible second and third wave.
That is so sobering. Just as we wrap up, because I don't want to leave people with that note, as honest and real as it is. Amara, you came up with a dance move and a challenge that people really rallied around to kind of raise money, which I thought
Yes.
was fascinating. I
Yeah.
think I can dance, but my wife disagrees. So I wouldn't bother try. But maybe you can just tell us, before I ask everyone our final round of questions, my final question. Tell me how you came up with the challenge. I'm going to show it and share it on the screen. The person
Oh
who's
my
taking it
God.
away from me. Just walk us through what we're seeing here. Take a look. What are we seeing? Wait a minute.
Oh,
Wait.
okay.
Is this
So
the video? You see it?
this is actually the video of the winners of the dance challenge. Basically, I just wanted to come up with something innovative, something fun, because obviously during quarantine, you know, TikTok and Triller became even more popular.
Right.
People are just finding ways how to maintain active and not lose their minds while they're home. So they actually were the winner of the $500 Andale challenge. They were very creative, uniformed and everything. And not only because of the Andale challenge, I also want to take this moment to let you guys know that now during quarantine on my Instagram, starting the month of May, I am going to be having My Mom is the Bomb. It's like this IG that I'm going to be doing with my mom and other celebrity moms and daughters as well. And I want to give a special shout out to Mayel Organics, Black Radiance, Pearl Black Vitamins, and Beauty Water, amongst other companies that are going to be working with me, because not only am I going to be having my Wednesday chats, but on Saturdays I'm going to be having Stay Fit, which I'm also going to be talking to trainers, nutritionists, and all that good stuff, because a lot of people, while we're home, we keep going into that refrigerator, eating everything that's there because of anxiety, or you just get bored. So this is a good time to really boost up our immune system, learn about our bodies, figure out ways to stay healthy while we're home, because we realistically don't know how long this is going to last. So, you know, staying active and staying busy, whether it is that you want to Zumba, Pilates, yoga, twerk, whatever works for you, but just stay active.
Okay, great message to end on, and staying active is what's giving you hope. I want to
Yes.
kind of get a final question from everyone else on what's giving you hope. Dr. Drummond, let's wrap it up with you.
What is giving me hope? I would say that the thing that's giving me hope right now is panels like this. It's been really awesome being a part of, seeing the collective spirit. I call it the collective human spirit of everyone around the world, really working together to combat the physical part of the disease, but also the mental health aspect. That's been giving me hope that, you know, this is humanity. And so I love to see that.
Thank you for that. And Rachel, what's giving you hope? And how do you think we'll come out of this?
Well, I don't know how we're going to come out of it. Personally, I'm doing, you know, exactly what the government is advising. Stay home, stay distant, you know, because it's actually not far from my office. We're taking all the precautions that we can to stop it spreading. And, you know, the hope here locally is that most people are sticking to those rules. And that gives hope, you know. And for me personally, I just love the positivity that my daughter just gives me every single day. That just kind of fuels me. I love how excited she is about our product. I love how she spots all the aloe vera that we see on the side of the road to say, "Mommy, you need that for your hand sanitizer." It makes me feel like I'm doing something good, even if it's small. And, you know, like it's all we can right now is stay focused and just do our best.
All right, thank you for that. That's beautiful. And how about Shahan? What's giving you hope these days? And how do you think we'll come out of this afterwards?
Errol, I think during times of tragedy, the indomitable human spirit gives me hope. Because I'm seeing that in South Africa every single day. Like I said, there are millions of people going hungry, but there are also millions of South Africans who are trying to help those hungry people by simply, you know, putting together food parcels and taking it to communities that are suffering. And that gives me hope on a daily basis. Because I know we'll emerge from this a stronger nation and a stronger people. The light at the end of the tunnel is exactly that. How we will eventually overcome it and what we learn about humanity after this. That's what I think.
I think that's awesome. And Isha has her daily show, so she just had to run so she can get ready for that. So be sure to tune in to At Home with Isha Sesay. But she also has a show called The Bright Side with Isha Sesay. She's trying to also bring light into people's lives. And I think we're all realizing our own skills and benefits as we try to help each other get through this pandemic. I do want to send a special thank you to Simone Brezzi-Ando. She's formerly of BET International and helped me produce this panel with all of you. Could not have done it without her, so big thanks to her. And thanks to all of you, Amara La Negra, Isha Sesay, Dr. Drummond, Rachel, Shahan Ramkissoon. The conversation continues in the comments. So even after this video posts, I know you guys have agreed to kind of answer people's questions in the future as we all try to get through this. But thank you all so much. Be healthy, be well, and I hope to see you all again soon. Thanks, guys.
Thank you for having us.
Bye, guys. Thanks.